What does a daily cleaning of your unit look like?
Yeah, daily cleaning, one, it's going to depend on which hearing aid you have, but I'll kind of speak globally. Wiping it down, on a daily basis. Most of the time it comes with like a cleaning cloth, like in your kit that you get. So just wiping it down with that cloth, using a Kleenex, a paper towel.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
It is officially the first week of June, which means we are going to gift you a brand new episode of Ask an Audiologist. I am your host, Kevin Ziener.
And I'm Dr. Jordan Strong.
This is probably the most applicable topic we have ever had on this podcast as it relates to every single person who has ever worn a hearing aid. And that is, how often do you need to perform hearing aid maintenance? From Dr. Emily McMahan at Alaska Hearing and Tinnitus in Anchorage, Alaska. Dr. Jordan, there's no time to dilly-dally with this subject today. Take the reins and start where you will about hearing aid maintenance and how often it needs to be performed.
Yeah, it's crucial. If you're this is a device that you're going to wear every single day for the majority of your day. And you're putting it into your ears where there's typically wax, and expecting them to perform optimally every single day with every conversation, so it's critical that you keep up with the maintenance on your hearing aids. They're only as good as they are basically clean, honestly, is, with putting them in your ears day in, day out, it's going to build up. So if you can stay on top of it, do regular maintenance.
I was going to say, I'll read we have a list of 10 things.
Sure.
And you can expand on all 10 of them.
Sure.
So the first one is never. Emphasis on ever. Skip daily cleanings. What does a daily cleaning of your unit look like?
Yeah, daily cleaning, one, it's going to depend on which hearing aid you have, but I'll kind of speak globally. Wiping it down, on a daily basis. Most of the time it comes with like a cleaning cloth, like in your kit that you get. So just wiping it down with that cloth, using a Kleenex, a paper towel. If you're going to use something, like an alcohol wipe or something like that, you've got to be a little bit careful with that. You don't want it to be too wet, and then it's going to get down to the hearing aid. That's going to cause moisture problems. So be a little bit careful with that. I recommend more than anything, if you can take the earpiece off, like if you're using a dome, taking that off and wiping it down before you put it back on, letting it dry. That's probably best.
Got it.
But I also recommend you can even use just like a soft toothbrush. Or sometimes in your
Not
kit.
a toothbrush you're using.
Correct.
Just a toothbrush you've set aside to clean. We don't want you to conflate the two.
Correct.
Okay.
But sometimes in your kit, you'll also have like a little brush that comes from the manufacturer. You can use that too. And just brushing it off, getting the wax off, getting the, where they sit. I mean, they're subject to, hair, shampoo, skin, all these things. So
regularly replace the wax filter.
Ooh, yeah. Yeah. So that's another one. So most hearing aids have a filter on them. Which means that underneath, like if you're using a dome, something like that, underneath that, there's a filter that's there. Every day you're putting that down into your ear, and it builds up just a little bit more, depending on how much wax you produce. And that filter, over time, will fill up. When it does, you're going to put the hearing aid in and say, what happened? When that happens, that's typically when you know, all right, maybe I need to change my filter.
Now, I know some people produce more earwax, some people produce less. On average, what do you recommend somebody change their earwax filter? How often?
Yeah, it varies so much. It's really hard to put a number on that. I'll say for the majority of my patients, probably around 4 to 6 months.
Okay.
But
we're not talking like once a week here.
Right.
I mean, we might for some of you, but majority of people know.
Absolutely. I have some patients that are an every week. I have one that's, some that are once a month, whatever that may be for you. It just depends on how much wax you produce. I will say, and you may be getting to this part, is we have our patients actually bring their hearing aids in for like a deep clean of their hearing aids. So And I think for most clinics, on average, they're doing it about every 6 months.
Yeah.
So for some of our patients, they never have to change their wax filters because they come in, we do it for them every time.
Got it.
And that's sufficient for that person.
That's actually point number 8. Schedule at least 2 to 4.
Skip some
No.
steps.
It's perfect because you're taking them off my list. Schedule at least 2 to 4 hearing aid checks with your audiologist, like annually, to make sure that that's taken care of. Something that people don't think of, keep your hearing aids dry. There are some hearing aids that are waterproof, but ultimately they should always remain dry.
Yes. So that depends on like, if you're somebody who tends to sweat a lot, being careful with that. Either take them off when you know that you're going to be outside and it's, like in my area, it's 110, take them off, or if you know that you're going to be in like a humid climate, even, things like that, take them off. You can purchase a dryer. Some dryers that are just have like a desiccant in it. You change that out every so often. Put the hearing aids in there at night.
Got it.
But if you have like rechargeable hearing aids, some of the chargers that come from the manufacturer actually have like a drying, either like a drying agent in it or just the current that runs through it can help to dry it
Got
out.
it.
So sometimes that helps too. And then there are also like electric dryers.
Is that like a Redux? Is a Redux dried out?
Yep.
Got it. Kevin
There
from
you
deep
go.
down. How about this one that I don't think a lot of people think about? Take your hearing aid batteries out at night.
Yeah. So one thing with that is a lot of people are moving towards rechargeable. They don't have disposable batteries anymore. But if you do have disposable batteries, opening that battery door and then really exposing that battery so that that whole compartment can air out, that helps a lot.
Got it.
Yeah.
I know, and I've seen this before in clinic, most every hearing aid now has an accompanying app with it. So when you have your app downloaded, just be on the lookout for technology updates.
Yeah. So, and not every one of those apps even show you that there's an update.
Sure.
So sometimes it's a matter of when you come in for like your routine cleanings or checkups, that type of thing, that the audiologist or maybe one of the assistants in the office may run the hearing aid through the software to check to see if there's a firmware update. It's kind of like the updates on our phone. They push out, a new release every now and then.
Yeah.
Just it runs more efficiently.
Sure.
Yeah.
What about, obviously you have to be on the schedule. They can't just come knock on Dr. Jordan's door every single time something's wrong with the hearing aid. Like troubleshooting it at home. What are some things that people can do on their own with their own kind of information to see whether or not there's an issue with their unit? Yeah.
Definitely. I tell all my patients, first thing is try cleaning it, wiping it down, checking the dome. Is there wax that's down inside of the earpiece? And then checking the wax filter. And then after that, sometimes it's a matter of checking, is it not working in general? Is it not working with your phone? Is it not working with the app? And kind of triaging and figuring out what's going on. Because we do have some patients that will come in and say, my hearing aids aren't working. And it's a matter of, well, it wasn't working with the phone.
Got it. And so, but what you're also saying there is, hey, if you can fix it on your own, awesome. But if you're able to come in when we have your appointment and give us a thorough debrief about what the potential issue is, we can correct it and actually save you more time.
Absolutely.
As well.
Yeah.
One of the things it says is forego DIY cleaning. Like if it didn't come in your hearing aid box or didn't come from your audiologist, it shouldn't really be used, even though Jordan just said toothbrush. It shouldn't necessarily be used on your hearing aid.
Correct. Yeah. Just a dry toothbrush.
Got it. Yeah. Dry toothbrush.
Yeah. And I say that because sometimes the brush that comes in the kit from the manufacturers, it's so tiny. It's very small. A lot of these patients have dexterity problems. So holding that tiny little brush, it's just, or you drop it and it's gone forever. Yeah. It's easier to kind of hold that toothbrush and it does the same job. Just don't wet it or anything before you use it.
And certainly don't put it in your mouth.
Correct.
And then check the device service warranties. I mean, I think a lot of people just assume when I get a piece of technology, it's good forever. And after year 3, 4, 5, you just might be in line for a new hearing aid.
Yeah. Yeah, absolutely. Typically, your hearing aids are going to come with about a 3-year warranty.
Got it.
Depending on the clinics, sometimes we can offer like extended warranty types of things. But on average, no more than about 5 years on that warranty. So definitely check and stay on top of that. And when you go in for those routine cleanings, ask them how much warranty do I have left?
What's the most, we'll end with this question. What is the most common issue you see with hearing aids that people can correct at home without ever having to talk to you?
Hands down, filters.
Got it.
Hands down. Cannot tell you how many people we see in a day that come in and they're like, my hearing aids aren't working. And then as soon as we look at it, we can see that the filter's completely clogged with wax. And as soon as you take that filter out, you can hear the hearing aid, come back on.
Got it.
And it's a simple thing that you can try to do from home. But we also understand that sometimes it's hard for those patients to see that the filter's clogged.
I have seen those things. They are small.
They're very small.
Very small.
And then sometimes it's hard for them to change it. Again, it's a very small tool to be able to get that filter out and put a new one in. So that can be difficult. And we understand that. So yeah, I would say filters. Got it.
Well, for even more information about this subject, and trust me, there is way more, head on over to askanaudiologist.com. Dr. Jordan, I know you could have spent an hour talking about this. I'm sure it takes up the majority of your day. So as a hearing aid professional, to be able to shrink it to 10 minutes is like no small feat. So job well done.
Absolutely.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
I'm also a specialist with cochlear implants, so I work with these things a lot. And so
it's like, I'm just so impressed that you know what your job is. I'm
Amazing.
like, wow, we really should ask an audiologist. He knows what he's talking about.
Crazy.